Humans have a concept of time. We know that when I'm 40, I'll do this, when I'm 60, I'll do this. Dogs don't have that. They live each day like a new day.
Every dog and cat owner should have like a first aid kit at home.
Big fours, I call it, for
Okay.
maintaining the health of an animal.
If you know your vet is closed on certain days,
Yeah.
it's always good to have a backup vet.
Every animal till now that I've treated, it has healed me in some way.
What is a vet's oath?
Some dogs, if they are not
Socialized.
used to humans, for them it's really beneficial if you have a behaviorist or a
Yeah.
trainer at the shelter or the rescue center.
A lot of pet parents rather go on to Google before coming to a vet.
Cats like me. I don't know why.
What is the difference between a private vet, a government vet, a welfare vet?
Difference.
Salaries?
That's so true. Yes. Shelter, sanctuary, rescue center, ABC center. All of these are different things.
When you medicate an animal, it's always based on the weight of the animal.
We are really happy to have responsible pet parents. It makes our work so easy.
My name is Shivani Mathur. I'm a canine behaviorist. I run an individual initiative in Goa called Give Goa Dogs to help raise the standards of animal welfare in India, working with NGOs, with experts in the animal welfare space. I've had dogs all my life. This one, his name is Stupid, for Stupid Cupid, and I have another indie called Lucy. So I'm doing this for them and their friends. Today we have with us a wonderful vet. Her name is Dr. Anaita. She and I worked together recently on my camp called the All Dogs Matter Camp, which Her Welfare, Worldwide Veterinary Services and Give Goa Dogs did in partnership. And yeah, here's Dr. Anaita, and let's get this podcast going.
Hi Shivani.
Why don't you tell us a bit about yourself and where you're from?
I'm actually from Mumbai, Thane. I've been there for many years and I've been born and brought up there, and I've studied there. I've done my graduation there. Then I did my post-graduation in Kerala, and since then I've been like in different places all over. So finally then I settled in Goa. But yeah, it was always my dream to come to Goa and like have like a nice retired kind of life, but it's not, believe me, like the amount of work we have here is the same. So
Yeah.
a vet never gets to rest.
So, Doc, what is your first companion animal memory?
So when I was really tiny, like my family did have dogs and cats. My maternal side were not very comfortable with having animals, so me and my brother would take care of street dogs, and we had a lot of pets in that sense, like taking care of them and feeding them and things like that. But my first memory would be like a cat who like actually found its way into my accommodation, and yeah, so I just remember
What
him.
color was the cat?
Ginger. He was a lovely ginger male, but obviously because he was a male, he went off to find his
What did you name
girlfriend.
him? Do you remember?
His name was Chomu.
Chomu.
Chomu, yeah.
And what made you want to become a vet?
So since the time I remember, that's the only one profession I really wanted to do, because then when you like love animals, and not as pets but just the street animals, and kind of have a bond with them, you want to always help them in some way, because there's obviously nobody to take care of them. So then it just kept repeating in my mind that I should do something for them. And then when we learned about what a veterinarian is and what he does, and I think in some grade we have a poem about a veterinarian.
Oh, wow.
So when we went through that in school, I was like, this is what I want to become. And I never knew it'll be so challenging. I thought it'll be all about like petting animals, playing with them. But yeah, as you get into the field, you realize how complex it is. So,
Yeah.
and the funny part is like when I was staying in an area, and like everyone, most of them had like pets. So I would actually recognize those people with the name of their pets. Like it was Mr. Brownie, it was like Uncle Tommy, like that kind of thing. I didn't know their names, like whatever their names were, but I recognized the pet, and I would name them. So yeah, so I think I've always
Love
was
them.
driven to become a veterinarian.
And how long have you been practicing as a vet?
Oh God, I can't remember, but should be around 12, 13 years now. Like,
Yeah.
because since, I mean, when we are in the final year itself, you get to practice your internship. And then when you're a postgraduate, you need to, like, do your clinical work there. So, yeah, it's been 12, 13 years.
Which was your first veterinary job? Which city? Where?
So it was in Mumbai at the lovely Happy Tales.
Oh, those
And
are my vets as well.
It's an amazing place, and Dr. Karkare, everyone knows, Dr. Nicole. So all of them have been my mentors and guides, and they like, it's amazing to see how they handle animals and how they handle clients, and it was an inspiration. But yeah, so then I did 2 years of private practice there. Then, like everyone, I wanted to explore the government side of things. So I did 2 years of government service.
Where?
It's in a village called Beed in Maharashtra. So it's
Okay.
a very drought-prone kind of area. Initially I was quite like positive that I'll be able to like continue doing the work, but the climate conditions or even like the working conditions, it did not suit me. So I then decided I would go into the field of animal welfare and try to join some charity or NGO and kind of help them out with whatever experience I've gained, and try to be a part of that. So I've had a idea of all the areas of veterinary fields.
What do you love most about your job?
Okay, that's a tough one. I mean, actually I love everything. There will be a few points where you feel really drained out, or you feel like very stressed about some things, because for all that matters, it's about animals, as they can't say, they can't speak, so you just have to imagine how much pain they are going through and things like that. So you have that emotional kind of bond with them. So that kind of like is important also when you're working as a veterinarian, to have a bond with your patients.
So you love your bond. That's your best
Yeah,
part of
yeah,
your
that's
job.
the best part. I mean, I feel like every animal till now that I've treated, and it has healed me in some way. Like when you see them recover, it's like amazing. It's like they're so resilient. They're so like they have that survivor kind of spirit in them. And when they're fine, like they come to you and they're like, oh, you remember, doctor, you treated him, and he survived. So I mean, that makes me so happy that I forget all the negative things what people, if they have said and kind of blamed or something. So it's just amazing, that kind of feeling. Yeah.
What is the most challenging thing about your job?
For the free roaming animals, the challenging part is just to kind of sometimes when they're so sick, you don't know what their future would be. Like they have no one to take care on the street. So whether to put them back on the street, or whether to get them a home, or if they're old dogs, nobody would adopt. So that becomes very challenging to form a kind of treatment plan for such animals. Whereas I would say if it is an like pet parent I'm dealing with, it's more difficult to deal with the pet parent.
Why?
Rather than
What happens?
I mean, not always. I wouldn't generalize, but like most of the times, it's too much of like obviously they're attached to their pet. We understand that, but there is too much of kind of cross questioning. Like if there are questions, we welcome that. We're like, yeah, you please ask about the health. But everything, if you kind of try to interfere with the treatment, like if you suggest a treatment, they would directly say no, that they don't want to get it done. So then it kind of blocks our
So
path.
could you
of,
give like an example, like that
so
people...
generally, see, if it is something like a small mass or a tumor, that we feel that it should be removed and sent to the lab for biopsy or things.
To ensure that there is no
Yeah,
cancer
there is
in
no
it, right?
cancer. Then the pet parent would start thinking, is it worth putting the dog through surgery? Should it like what about
Which
post-op?
also,
Will it be
doc, if you think about it, these are normal
True.
questions. Like if you have to put your
Correct,
child
correct.
through surgery.
True. Like we explain the risk of anesthesia, everything. But the thing is, unless you get like a proper diagnosis, or if there's a chance that we can actually save the pet, when they're really geriatric, like they're very old, yes, there is a lot of complication, and we might suggest not to remove the tumor, let it be if it's not, kind
Yeah.
of causing any pain. But if the tumor is really bad and the dog is suffering in
Yeah.
pain, it's better to just take it out
Yes.
and, like make sure that the dog is free
I mean, that's what we just did with
pain.
Khujli as well,
Exactly,
right?
exactly. Khujli was
Yeah.
there. So it was tiny, so we could remove it in time.
That was tiny?
It was tiny, yeah. This is tiny.
That big thing on his
We
leg
have
was...
removed a 7-kilo tumor, Shivani. That's
How
like
big is that?
It's huge. I mean, it's this big, but it's very heavy. So it was a Labrador, and inside the abdomen. So we've removed this from the. It's like
Oh,
it was
wow.
crazy.
And how
So,
long was that dog with that?
some owners will say, oh, we just saw the swelling yesterday. But when you actually go to see, it's been like a year that the tumor is slowly growing. So that's what I'm saying. Regular health checkups
Yes.
with the vets, and that is very important.
So, like, I mean, that's something I wanted to ask you
Yeah,
about. You know, like health checkups.
Yeah, correct.
What is the ideal health checkup schedule for a puppy, for a senior dog, and for a adult dog?
Big fours, I call it, for
Okay.
maintaining the health of an
Yeah,
animal
is-
would be deworming,
Okay.
vaccination,
Yeah.
tick and flea prevention, and nutrition. So
Okay.
if you take care of all these things, obviously your vet visits are going to reduce because your
And this is
animal
for
is
all
healthy.
dogs?
All dogs, whether it's a puppy,
The
adult.
big four it's called,
Yes,
huh?
a big four, yeah.
Nice.
And yeah, so puppies, when you take them to the vet, obviously you have to take them for deworming, you have to
Yes.
take them for vaccination. So that vet visits will happen every
Yeah.
month at least, you know,
Yeah.
for the puppy. But once it's an adult, once it crosses 1 year, then you usually take your healthy pets once a year for vaccination.
Adult becomes 1+.
1+ is an
An
adult.
adult.
We consider it as an adult.
There are
So-
no teenagers. There's no teenager in doggies.
No, I mean they just go from puppy to adults,
Adult,
and for
okay.
some people, big dogs are also still puppies.
Yes,
So,
yes,
yeah.
puppies
but
always.
you have to remember they
you
are
got one puppy at your at your paws.
Big chunky puppy.
Yeah.
But yeah, so the puppies have to have regular visits, and adult dogs, see, if you're doing deworming for adults every 3 months,
Yeah.
okay, that's going to like save again your vet visit, because there are not going to be any intestinal parasites or worms which are causing
And this is
digestive
with
problems.
making sure deworming schedule.
Deworming
and
schedule.
deworming, like typically, like I deworm my dogs every 3 months.
Yeah, that's
Right?
perfect. Yeah,
Yeah, and
So-
it depends on the weight, how much.
Correct. It's dependent on the weight, so you have to get a proper weight check done
Yes.
before you deworm. A lot of people do come and say, "Oh, we gave 1 bottle of syrup to the dog," which
There's
is
syrup and their tablets,
yeah, but
right?
syrups are more for puppies because the quantity you'll have to give less. If a dog is so big, you'll
Yeah.
have to give like a 2-3 bottles of that
Like
syrup.
Stoopy has,
Yeah.
Stoopy is approximately 27 kilos. I give him
30, yeah.
two and a half tablets
So if
of
he is
Drontal.
around 30, he'll require 3 tablets like that. So
He's not hit 30 yet. I'm hoping to bring him back down to 25.
He has to, yes.
Yeah.
So yeah, that's what, like, even so when you come to deworming, then you come to tick flea prevention. So now if you see in our clinic at Hicks, every day we're getting at least 3 to 4 cases of tick fever.
And when is tick flea season now, right?
Now the summers are horrible. Like
Summers.
winters are supposed to be healthiest, but
Yeah.
the summers are like everything, like from like tick fever to like just heat causing problems, heat strokes, everything.
Yeah.
So that happens during summers, and rains are more of like parvovirus, distemper, infectious diseases are
And the
more.
9-in-1 vaccine or the 7-in-1 and the 5-in-1 prevents this.
Very important,
And
yes.
is along with an anti-rabies vaccine, that
Correct.
9-in-1 vaccine is as important
Has-
for our
yes,
dogs,
yes,
right?
has to be
and
done.
what does 9-in-1 stand for?
So there are it gives protection against 9 viruses.
Which are?
There's against parvovirus, there is against distemper, then there's a virus which affects the liver, like hepatitis it causes.
Okay.
Then there is leptospirosis, so it protects against
What
3-4
is lepto?
Oh, lepto is like really scary, and the worst part is it is zoonotic. Like you
Yes.
can get it from a dog, you know, vice versa, and you know it can spread. It happens because of rats. Like you
Yes.
know, the rats are the main. They spread the disease. They don't get it, but they spread it.
Got it.
So especially after rains and all, when there is waterlogging, if a rat is carrying the disease, urinates, the dog licks the urine or eats the rat or whatever, that dog will get leptospirosis, and very bad form of jaundice and kidney failure, and it's really sad. We have saved a lot of dogs, but if they have been presented to us in time, like you know, to start the treatment.
So ideally
Otherwise
give
it is
that
deadly.
9-in-1 yearly, right?
Yes, you have to give, and that's also, if you give the 9-in-1, it protects against most of the strains of the lepto.
Yeah.
But if you give the 7-in-1 or the 5-in-1, it doesn't give protection against all the forms
So
of lepto.
people should know what is in the 9-in-1,
Yes,
what is in the
yes. Always
7-in-1,
ask, yeah,
5-in-1, and protect your dogs
Correct.
to the
It's
best.
much better, much
And you mentioned the term zoonotic diseases.
Yes.
I became familiar with this term only a year ago before we did our camp. So
Okay.
could you tell people what a zoonotic disease is?
So zoonotic disease is something which can be transferred between different species, like if humans and animals are involved. So it is, you know, intertransmissible, and especially like the major diseases that we are really worried about is rabies for sure.
Yes.
Then there are things like leptospirosis, like
Yeah.
again zoonotic. There are some more diseases again which can, like, certain skin diseases like scabies.
Yeah.
It's a form of, like,
Zoonotic disease?
yeah, it's a zoonotic disease. Like,
Okay.
you will feel like itching and things like that. Then there is things like ringworm and things, skin
Yeah.
diseases especially. And yeah, there are certain more things that will spread. But yeah, the major thing we have to worry about in India is rabies.
Okay.
And everyone, I feel everyone who's regularly in contact with animals should get a, yeah, they should get like a
Pre-exposure shot.
prophylactic shot of anti-rabies, because why wait for getting bitten and then going in for post exposure
Yeah.
vaccines.
So people like dog feeders, trainers.
Yes, very important.
Anyone working with animals,
Correct,
so
correct.
salons,
Yeah.
daycare, all
Yeah,
of that.
everything,
right?
everything. Yeah, it's much better, and that's actually the main way to prevent it is to actually vaccinate all the dogs, okay, in a particular country or particular area, and maintain strict kind of rules
regulations.
regulations for import export, and surveillance to find out where there is more number of deaths due to rabies and things like that. So the government also has a very important role to play
in these
Yes,
anti-rabies,
yes, in anti-rabies.
vaccinations.
So I mean,
Yeah.
there is a hashtag called as 0 by 2030.
Okay.
Which means
Yes.
that by 2030 we want to eradicate
Rabies from India,
Yeah,
no?
yeah.
Yeah.
So there are a lot of pockets in India that just need like proper mass vaccinations actually for
Yeah, yeah.
dogs. Yeah, that's very important.
What is a vet's oath?
Vets oath.
Oath. Like, what is the oath you all take? Is there
Basic-
an oath?
There is there is an oath, but like I don't remember the exact oath, but yeah, it's basically that you will not let an animal suffer, and you will kind of do your best to save an animal from
Similar-
pain and suffering, similar to what humans have. Very
the
similar.
human
to that.
doctors, yeah.
yeah. But I think as a vet, you actually become like an advocate for the animals.
Yes.
And I mean, when you are having pet dogs or pet parents, like they have a different communication going on, so you can let them be. But like especially the street dogs or the free roaming dogs, like you can actually make a decision for them, like what treatment they should have, what kind of
So
care
you
they should
basically
have.
are the guardians of the street dogs, right?
People also abuse this kind of rights, and they like maybe not pay attention to the welfare aspect of the animals. Like
Yeah.
you see shelters that are not properly maintained, or
Yes.
many shelters in India don't have vets. Like that is so sad. It's
Yeah,
really
what is
sad.
that? What does that even mean? How do you run a shelter without having a vet? Because I mean, the whole point that these dogs are in there is they need help, right?
Correct, correct. So
There's a difference between a shelter and a sanctuary.
Correct,
I keep, talking about this all the
Shelter,
time.
sanctuary, rescue center,
All need a vet?
ABC center, all of these are different things. Like people,
Exactly.
you can't combine it, but yes, all of them need a vet.
On ground.
Yes. I mean, at least maybe a visiting vet, but he has
daily-
to visit regularly. Yeah,
Yeah, not like once a week
Not
or-
once a week. Yeah, regularly, because
Regularly.
Yeah, they have to monitor the patients, right? We have vet nurses, we have veterinary assistants, but they can only
But
assist.
that's it at your shelter, or is that at every
everywhere,
shelter?
Everywhere.
Okay.
If they cannot afford vets, they would hire a
the vet
assistant.
assistants.
Yes, so that they can actually give basic care like bandaging and
Yeah.
medicines and all that.
Yeah.
But again, you actually need a vet to do all the
Checks and
treatment
pre-checks
plans
and
yeah,
all of
yeah,
that.
yeah.
What is a regular day in the life of a vet? Like, what's your regular day like?
I wake up at 6:30 almost and try to do some exercise. So I usually foster a lot of these puppies and things like that.
You
So-
foster as well.
Yeah, I foster puppies and kittens. So because it's not enough, working 12 hours, you have to work more at home. So I
Yeah.
take on more responsibility. So no, it's fun to foster. And yeah, so if the foster pup is sleeping and does not disturb me, I try to do some exercises. Otherwise,
Yeah.
when you're doing something, they come and jump on your head and this and that. So I try to do that. Then I have to get to work by 9.
Yeah.
And then at 9, work starts. And when I'll tell you, like from the time I enter the clinic, like 9 till 5, till 5:30, till I exit, the only break I take is a lunch break. I can only sit down when I'm having
you're standing-
lunch. Standing throughout. Because
Vets are standing the whole day, yeah?
we have to at least like clinic, you can actually sit next to the client and maybe like take down notes or whatever. But vets who are doing surgery, they're standing like throughout, because we have a lot of animal birth control surgeries going
Yes.
on again at our center. So those vets are like continuously on their feet, and I mean there are a lot of medical issues that happen to vets because of these long standing hours,
Their own
especially
health,
neck and back issues.
I
and-
remember at ADMC, one vet's hand something
Yes,
happened,
yes,
one
they-
vet's neck something happened.
Exactly.
I
So
remember.
those are all
Yeah.
occupational hazards, I call them.
Occupational
So
health.
Yeah, yeah.
So vets really need to stay fit, huh?
they need to really, I mean, again, like it depends, like if you can actually have some time for yourself, like in the day, like at least
I think you have to make that time,
you
huh?
have to. It's very difficult because after you come back also you might have some people calling you for consultation or things like that.
It's bound
so that,
to happen,
that never
right?
ends. Yes.
Yeah,
So,
that just.
yeah, yeah.
How many dogs and cats do you see in a day at the clinic at an average?
So the minimum would be about 35.
Wow.
And the
Okay.
maximum goes to 50 some days.
In one day?
Yes, in one day. And especially Mondays, Fridays, Mondays because weekend you get relaxed and you'll be like, okay, it's fine. And then Monday you realize the dog is really sick and you take the dog to
So
the
Monday
vet.
is your
Yes,
heavy day,
maximum.
huh?
And Friday because then again
The
you know
weekend
that-
is coming, so-
yeah, like unfortunately most of the clinics and all would be shut on weekends. Like we are shut because we work so hard for
So you
5
guys
days.
are like a salon, right?
Yeah.
The people run to the salon on Fridays
Yeah,
and
Fridays.
Mondays.
Exactly.
I mean, now of course they're open on
Correct.
weekends,
So,
which
yeah,
is
yeah.
important. But
we
my
have
God,
we have some emergency services for a few hours on Saturday and Sundays, but otherwise, yeah, we deserve a break that we
Of
can
course.
continue to work on
Yeah.
Mondays. Yeah,
who's been your most inspiring client?
I mean there are so many. I can't think of one single client. Like there are some cat people who have like really taken care of the cats so well, and like just to see that they are
I meant the
dedication-
animal, not the human.
Oh, okay, then
Yeah.
that's
Yeah, I'm talking about the animal.
that's easier then.
Yeah.
Okay. So, like I would say, like there are these dogs which I might have seen 7 years back, and then just they randomly, like there's this lady I know, I think her name is Daphne or something. She brings a lot of pups and all to me, and she came in that day with a nice, like healthy looking dog, a nice chonky dog. 7-year-old, and she's like, doctor, do you remember me? I said, yes, Daphne, I remember. You keep bringing. Do you remember him? I'm like, do you remember her? Sorry. Like, I think I remember. This is Princess. You saved her from parvo virus, and she was dying. And that 7 years back, and now the dog is so healthy.
Oh, that
and
felt good, huh?
I felt so good. I mean, these people are like good. I mean, they're good caretakers of animals, so they will do everything in their.
I can
hands
clearly
to
see you're a
actually-
good caretaker of animals. My dog is sleeping at your feet.
Yes,
That's
he
Stupi,
knows.
by the way.
Yeah, he feels comfortable. But yeah, so these kind of animals really like I said, they heal you in some way, na? Like you're so happy when you see them recovering and things like that. So
How nice.
it's been amazing. Yeah.
Who's been your most challenging patient?
Challenge. I mean, I would say most of the dogs which are really anxious and scared, and they might be reactive because again they're not being trained and kind of like
Trained dogs
behavior-
also get reactive, doc.
they do so
Dar lagta hai.
yeah so no, I mean I feel if from a young age if you can expose them to
Socialize
yeah
them.
socialize
Yes,
them
yes.
and get them to the vets for regular checks and things
Or just like
that.
a happy visit.
Happy visit,
Do
yeah,
you
just-
do you encourage happy visits at your welfare?
Not much because we sometimes worry about the environment because we have
But do you think
inpatients.
it's beneficial for the dogs?
I feel you can bring them in for like a general check. Our general check involves just like feeling the dog
Yeah.
and things like nothing very invasive.
Yeah.
So if they come even for that and
वही हो गया ना, happy visit.
Yeah, and we give them a treat or something,
Yeah,
so they're
just
very
come
happy.
say hello to
Yeah.
your vet and
That
go.
is fine. But just if nothing is wrong and just visiting, we have a lot of patients coming in where initially we don't know what's wrong, but then
Yeah.
they pass stools with a lot of blood or they
Yeah.
show that they have discharge, and then we are like panicking like, oh, this could be
Yeah.
distemper, this could be parvo,
Yeah,
take the dog to a isolation area and things like that. So I worry about healthy dogs being brought very often to the clinics, but yeah, I do
But what if
encourage
you had like a
visits.
separate section for just a happy visit? Wouldn't that be cute?
It would be very nice, and,
And it
I
will-
really hope someone gives us some extra space for
Yeah.
this because we are a very small center, but
you need the
we have tried to
space.
fit a lot of infrastructure, and like we have everything under one roof. But I somewhere feel like if we get like a huge area, we can make such good use
So
of
we'll make
it.
that in the dream wish list for
Yes.
Hicks, huh?
Exactly, yeah.
What is your personal secret tricks to get a dog or cat to be comfortable with you?
So I have observed that like I love dogs a lot, and So I approach them in a way that they are comfortable. So I lower myself and, you know, like maybe baby talk with them and just like don't do direct eye contact and
Yes.
things like that. So that kind of thing, I like slowly ask the name of the dog. So then I call out
Yes.
the name and things like that. So the dog kind of knows that, okay, he knows my name, so she knows my name, so it's a little, they get a
Familiar
little
person,
comfortable.
yeah.
Yeah. But yeah, then when I go to do some checkup, the dog realizes, oh, okay, this is a vet and not like a friend. But I try to do that kind of thing, and I spend little time petting and things like that. Not
Yeah.
only like if they come for blood collection, I just don't collect the blood, do the sample.
give them some
I give
time.
them some time. I'll
I
pet
think that's
them.
important for the
Yeah,
dogs to
yeah.
de-stress
You
and,
have to give some time to each and every patient.
and talk to them.
On the-
I saw you giving wet food to the
Treat,
puppies.
yeah,
I'd
that's
say.
really helped. Like we've started it recently, but we've seen like, you know, puppies getting more comfortable with
Yes.
us, and
Adults
you know,
also? So-
Adults we give only when the parent complains that he's not eating anything,
Ah.
and then when we bring out really delicious canned food, it's like gobbling
Yeah.
up. So we're like, see, he's just like, you know, being a little fussy. So maybe it's not that. But yeah, we don't regularly give treats to dogs because we don't know their diet and what if it upsets them or something like that.
But
so we
like as a
avoid.
de-stress protocol, don't you think it's a?
I think
maybe
it's
you
a
can just
good
ask
idea.
the pet parent. You know, is it okay if I can give them this just to get familiar?
I think it's a good idea. We should.
You know,
we'll
every
try that
dog,
for sure. Yeah,
every
yeah.
dog should get
Yeah.
something to eat at a vet.
Correct,
So
correct.
they're like ting 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 ting, and then meantime you can give them an injection. पीछे से
Correct,
जल्दी से,
correct.
you know, पता भी नहीं
True,
चला
true,
क्या
true.
हुआ.
So like I was saying, like dogs, I try to be friendly with an
Cats?
Cats,
How do
I
you do
think
that?
cats like me. I don't know
Oh,
why.
yeah.
Like I'm
Why do
not
you-
being
what do you
like
mean, I don't know why?
I'm not boasting about it or anything, but I don't know. I feel like when people are trying to restrain cats and all, they're very like
Rough.
unsuccessful, and the cat doesn't allow them to do. But on the other hand, when I go, like, you know, I just hold the cat for a few seconds, the work is done, and then I release the cat. So I don't know, I feel that even, like I said, like the
She
first...
sounds like the magic vet, huh? Okay.
okay, not the magic vet, but I kind of, maybe they, you know, are more understanding or something like that with me.
Animals sense
Maybe,
human
yeah, yeah, that is
intentions.
important.
Animals pick up
Yeah,
human
yeah,
energy.
yeah.
You know, it's there.
So like, that's what the first cat, the pet that I had,
Good.
he came in.
What is chonky?
Chomo.
Chomo.
Chomo. So it was like a rainy night and all that. So he just came into the house and he
Yeah.
was very scared. And next day he was on the bed, snuggling next to me and all that. Even now where I stay, a cat, you know,
Just comes.
has
An
just
outdoor
comes
cat.
to eat and, you know, sleep
Yeah.
on a porch and comes inside the house, takes
Yeah.
a walk. So I think just cats are attracted. I don't know, to me or what, but I love cats also equally. It's not
Yeah,
that.
yeah, yeah.
But dogs, yeah, I have a soft spot.
What is the most fun part of being a vet?
Huh. I think just petting, cuddling dogs. I mean, it's like you squish them sometimes, and it's fun. Like, you know, even when you're a lot of animals are therapy animals. You know,
Yes,
so I
yes.
feel every
Each
furry
one of them.
animal is a therapy animal. You just like run your hands 2-3 times, and you yourself feel very calm. You know,
Yeah,
and
yeah.
composed, and you know, like even if like say the client is like, you know, shouting at you or saying some cussing you or doing anything, like you just like pet the dog or cat and say it'll be fine, you know, like, and you know that you want to help the animal actually. So
Yeah.
you should actually not pay attention too much to the negative aspect. You should just like concentrate on your work. A lot of vets might think, oh, I don't, you know, like this client coming in, and you know, but I
Keep
think
the
they should
human
not
out
think
of it
about
and
that.
focus on the
Yes,
animal,
you focus,
right?
the animal needs your help, so that is more important.
So, like for me, my vets are one of the top 3 most important people in my life, being a animal parent and a dog
Correct, correct.
parent, right?
Yeah.
My relationship with my vets
True.
is super important to me. I love my vets,
Yeah.
and luckily my vets love me. You know, like Dr. Nicole was with Watson for 11. She's still with me. Watson
Correct.
passed away in 2021.
Yeah.
But the first vet I will call
Yeah.
without thinking in autopilot
Yeah.
is Nicole. Then there is Dr. Akshay, who's an who used to do acupuncture for Watson at AccuVets. Gwenda, I think she's worked with she used to be
Yes,
Watsy's pet sitter
Oh,
while
okay.
she was studying her veterinary
lovely.
sciences, and now she consults for Stoopy Lucy as well.
Correct,
You know, so these vets, now the whole WVS vet team are my, like, I'm just like, come on, Ria at pause.
Yeah,
Like
yeah.
I have a relationship
I
with
think-
vets across the country.
True,
You know,
true,
like
true.
they are so important.
Correct. I was
So,
telling you, you should have like a comfort vet, you know, like you can
100%.
you can go to a specialist, get things done and all that. But there's that one person that you feel like if he says yes,
I have many one people,
yeah,
many
that's-
one vets that I'm
that's good.
comfortable
That's
with.
good. That's good. You can
Yeah.
take different opinions. It's always
Yes.
good to take different opinions
Yes.
because you know you might be missing out on something. We also encourage that if we feel like the case is complicated, we will refer to a specialist or we will ask more well-equipped diagnostic
Yeah.
clinics to give us an idea of what is wrong and things like that. So it's always important to consult two or three people.
Like I remember when I came to Goa, I was really apprehensive about
Yeah.
because I've come from Mumbai,
Correct,
right?
correct.
So when we came in the pandemic, and Watson was already pretty ill, and Dr. Marilyn is who I was
yeah.
recommended to. So when we took Watson to Dr. Marilyn, I remember like it was the first time I was meeting her.
yeah.
I had been with Happy Tales for 10 years. Dr. Nicole said go to Dr. Marilyn, like take him there. And I remember when she was checking him and I was standing there, I read out his entire medicine schedule, this, told them about the nebulizer, told them about Astelin and Budicort. They just stopped and they looked at me, because they were just like, are you sure you're not a vet? Like, how do you recall
Yeah.
everything? And I said, I've been doing it. Nicole has taught me so much. And
Yeah.
what was amazing about Nicole is how I learned is because I kept asking my vet questions.
Correct.
I kept asking, I wanted to learn, I wanted to do the best for my dog. And so I just learned because I had to learn. That's my child, right? So it's so important as a pet parent also to be
Very
really clued in and in sync with your vet.
Know what medicines are going on, know what he was prescribed few years back, because a lot of
I have his entire medical
yeah,
history.
it's important because something which might have happened when
Could
it
be
was
affecting
could
him.
be, because there are some distemper survivor dogs, like maybe like a few survive the virus when they are
Yeah.
young, and then later in the stage they start developing nerve issues and things like that. So we don't know, and then we're like thinking what has happened, and then after 1 week of treatment the client will tell us like, oh, it had these signs before or had something when it was a kid and now it has. So it's very important to give proper history, very, very important. A lot of people still don't know how
Yeah.
to give history. Most of them are embarrassed to give history.
Why?
Like certain things, like in Hindi they say khoon aa raha hai, like blood.
Yeah.
His dog is bleeding. So I ask from where? From behind. Now behind where?
Ah,
Like
they're
from the
embarrassed.
stools, from the
Yeah.
urine, from
Yeah.
the
Yeah.
like vaginal discharge. What is it? So they're very, very this about. Then when you check, because again if the dog is not comfortable, you may not be able to check properly. So
Yeah.
if you go to check and you see where it is from, then you tell them the treatment and things like that. So the history giving is very important as much as history taking.
So as a pet parent, it's very important before taking your dog to the vet.
Yeah.
You yourself need to be prepared
Yeah.
with the history, or
Correct.
or even with like what is happening to the dog at that point.
Exactly, because if it's a house dog,
'Cause
and
you
the
guys aren't
mother
like,
and the mother is feeding, and
yeah.
the son is just taking the dog for walks, and the son brings the dog to the clinic and says, oh, it didn't eat yesterday, but the mother has fed in the morning. So then he calls up
Everybody
and
on the
asks,
family needs to
everyone
be on
and-
the same
yes,
program
yes,
with their
they need
dog.
to know what's
so
happening.
like what I learned very early with Watson was that again, Nicole had taught me, I've had dogs all my life,
Yeah,
so I
yeah.
know when you're taking your dog to the vet isn't really like a fortune teller. They can't I think you need to also be involved, not
Yeah,
just like
yeah.
here's my dog, figure out what's wrong with him. The more you as a responsible pet parent go and say, for the last 3 days I've noticed my dog is not eating, he's itching this spot, every time I feed him he's itching after feeding, so that way it's an allergy food based.
Very good.
My dog usually lies on one side, my dog is uncomfortable lying on this side.
Very
You as a dog owner are also responsible for the healthcare of your dog,
Exactly,
right? So you go
exactly.
in there
Yeah.
and you help your vet diagnose the best thing for your dog.
Correct,
And I have a feeling a lot of people are not doing that. They just bring the dog and say,
Yeah,
you
yeah.
figure it out. And how
Very
much
true, very
are you as a pet parent thinking of now you've gone to a clinic, there are 30 patients waiting. The doctors only have a limited amount of time for you. So you need to be responsible as a pet parent to go in there with all the correct information. And also it's a stressful situation for your animal.
True.
You need to get him in and out of there fast.
That's true. I agree completely.
You know, so go in there with your question, go tuck. This is what I feel, this is what I feel. So it's even easier for the doctor first to understand that, okay, you're a clued in pet parent, and then help your animal.
Yeah, I mean, we really encourage, and we are really happy to have kind of, responsible pet parents. It makes our work so easy, and it's so.
Are you happy with pet parents asking questions?
Very happy, yes.
Okay.
They should. I mean, it's for their pets. I mean, I can sit and give a 1 hour consult. If you want questions, you ask me questions. But yeah, that's the problem. Like, if I tell you something, you should take my suggestion. Like, a lot of pet parents would also do something like, if I tell them, like, use this product or use this for the animal, maybe not like exact product, but the content, it should be fine. It can be any brand or whatever. But then they go and they don't do that. They said, oh, I thought the dog is fine, so I didn't give. And, then they come back complaining that the dog is still not doing
But
well.
also, Doc, now I have personally, I mean, I can understand this because if they want to change something, right? How accessible are vets? Who do if they call the landline at the clinic, that receptionist can't tell them.
I agree.
So we need to find a system where you can text. Now this again comes back to your relationship with that vet. Now certain people are good at forming relationships with vets. Some people just don't know how to do it. So I feel that's where the lag is. So like, आज Saturday है, doctor को Monday तक नहीं बात कर पाएंगे. I feel that's where you're getting. I'm not saying everyone is like that, but I feel a large reason why that happens is because of the accessibility to the vet.
True.
There needs to be a middle person in there,
there has
right?
to be either, like, so whatever cases we do get and which need, like, repeat treatment for weekends, we'll always, like, refer them to a vet. We make sure the other clinics are open on Saturday, Sunday, and we'll say, see, this is the treatment you have to follow. You can go there and follow. If it is very serious, again, we will say that, please go to the vet, take a consult and see what they are saying, because these diseases that we are seeing are usually infectious diseases or tick fever, and they require the same treatment. You don't have, like, major changes in that. Unless, like, something happens on Saturday and you want to diagnose on Saturday, that obviously we can't do. So, it has to go to.
So is it good to having, would you say, if you know your vet is closed on certain days, it's always good to have a backup vet that you can access?
Always, yes, always. Because even, like, I'm so worried, there are some, like, I had this recently a cat, very sweet cat called Cassie, 15-year-old, and they were so attached, 3 ladies, all of them so attached to her, and, she had, like, asthma from, like, since a few years, and unfortunately had kidney issues also. So, it was a very tricky situation, but what had happened is she was unable to breathe. So, Friday when I saw her, she was, kind of struggling. Now, I was so worried, like, what happens if, Saturday she can't breathe. So, these people were, actually I told them that she might need oxygen. You might need to go to a vet. You can't get it at home. So, you do that. So, luckily Saturday, Sunday they found a vet who's open and could get her oxygen and things like that. So, it's very important for the vet also to communicate that this situation can worsen, and always keep, like, a backup vet for the weekend, so you know that,
And you should always have a clinic that you have access to.
Correct. Yeah.
Are there health conditions that dog and cat families can be aware of to like avoid from what you see on a regular basis? Can these things be avoided if pet parents were more aware of stuff? So like what?
So basically first you have to do your big 4 that I said, no?
Again, repeat.
The deworming, vaccination, de-tick, de-flea, and proper nutrition. So if you follow these things, for sure your vet visits will be reduced. But in case you feel at any point your pet is sick, so I would say if it misses, say, breakfast and lunch, it's okay. Sometimes dogs do have their own mechanism of fighting indigestion. They'll go and nibble on some grass.
Yeah, like mine have lemongrass.
Yeah, so cats and dogs both have that thing. They'll go and nibble on grass, and then they, cure their indigestion. They may vomit also after that. So we also, when we are full, sometimes, when you vomit, you feel better, like, okay, now you're empty, you're
now
not
talking
filled.
about vomiting, one thing I learned very early, thanks to Nicole, is if your dog or I don't know about cats, but
Mm-hmm.
my dog, she's like, if the dog would throw up, that acid builds up,
Correct,
and
correct.
that bile and whatever.
Correct,
So I
correct.
was told to not give any food or water for 4 hours.
Okay, yeah.
After the puking, that is
Yeah.
just
we
to
follow
ensure.
2 hours, so 2 to 4 hours I think should
Okay.
be fine.
Okay.
Anything, but yeah, you're correct. Once it vomits, people like
Try to
usually
give
give
pani,
water
yeah,
and this.
yeah.
No, that's not correct. That's what. So you have to give a gap, and in case that time you want to give an antacid or anti-vomiting, you can give after
Later,
2
right?
hours. Yeah, you can give it after
I
2
remember I
hours.
used to give Rantac.
Rantac. Those are the common ones. Like sometimes you have things at home, Digene and things like
Yeah.
that. Again, it's like how self-medication is,
Yeah.
getting crazier day by day. For animals also, a lot of people have started using human medicine.
Which
so
you have to be very careful
Very
about.
careful.
But like I know when my doggy Watsy's tummy used to be off, Nicole would let me give a little bit of 2.5 ml of Sparacet syrup in 1
Yeah.
teaspoon of vanilla ice cream.
Yeah.
I used to give him.
These are safe ones, like the ones you give for indigestion, acidity.
Yeah.
All these are safe. Like some, only the ones you have to be careful are antibiotics and painkillers. These are
Yeah.
very abused drugs, and
Like you can't give Crocin to a dog.
you can't give it to a cat for sure. Dog will survive a Crocin tablet.
But it shouldn't be given.
It shouldn't be given. It will damage the liver if you're giving excessively. People do use paracetamol in other countries injectably, which
Yeah.
is much safer. But oral Crocin, Dolo, all that is a big no. For dogs, usually they use other drugs like meloxicam and things like that,
Yeah.
which are much safer for cats and dogs.
Meloxicam tablets come for animals. no?
Tablets
Yeah.
and syrup also you
Okay.
get. But yes, next day you have to take the dog to a vet.
Vet.
Just to get that fever down, to get that dog little stabilized. You can
Yeah.
give little Crocin. That is only when you don't have any
Emergency.
other option. Emergency.
So
but
ideally don't give
don't.
it.
Yeah, ideally
So,
don't. Yeah.
so do you feel that every dog and cat owner should have like a first aid kit at
Very
home?
important, very
and
important.
there should be, so like if suppose you had to recommend it to me, what are the 5 things for my 2 dogs I should always have at home as a safety thing, like just general stuff at home?
So I would say like a first aid for treatment for wounds would basically be like betadine, which has to be
Yes.
very diluted and
Yes.
used. You can't use like
Direct.
You have to dilute and use
1:50 ratio, Nicole used
You
to tell
can,
me.
yeah. That is quite diluted. You can use that, but it should look like amber colored. It shouldn't
Not
be
be
like
that
dark brown.
blood
Yes,
red
it shouldn't.
brown, yeah.
So betadine. Then you need some nice gauze. Like the swabs to wipe something down. Then you can just like have a bandage,
Yeah.
thick bandage, because like say if there's a glass shard or something and then it gets cut,
Yeah.
till you take it to a vet, you have to make like a compression bandage. So
Yeah.
just to bandage it temporarily, you can have that, and a basic ointment, like any antibiotic ointment is fine. Betadine, something similar to betadine is fine. Soframycin can be used for
Soframycin,
some
yeah.
cases, like that. Neosporin.
Neosporin,
Yeah,
yeah.
you can use. But again,
Neosporin you get cream and powder, no?
yes, but Neosporin again shouldn't be used for cats. Yeah, so
this
that-
is we're
that's
talking
what
about
it's-
dogs.
Yes, we are talking about dogs. But if you have cats,
So
again,
like for dog owners, you should have. Watson used to have a lot of eye issues, so I used to always have Systane or Ciplox or
Yeah,
certain eye drops at home.
Basic ones,
For
yeah.
ears, I used to have Calm Ear.
Correct, correct.
For
Yeah.
paws, I used
your
to.
cleaners you can have, your drops you can have, eye drops, basic
Yeah.
ones you can have.
And get this list from your vet.
Yes,
For
yes.
your dog. There's an
Anyone
in-
will write and give you, like it's always better.
Have a first aid kit
Yeah.
at home for basic stuff.
In tablets you can have always like an antacid, either pantoprazole or ranitidine, whatever
Yeah.
is available.
Painkiller?
And painkiller, meloxicam is the only one we can recommend. No,
I used to
nothing
do
else.
gabapentin.
That is for so meloxicam for fever and for pain and for inflammation.
Yeah.
Gabapentin, yes. Usually, if you have like sometimes old dogs or
Yes,
dogs
mine was
with
a
nerve,
senior. Yeah,
yes,
nerve
if you have
issues.
nerve issues, then gabapentin works very well. For cats, also gabapentin works very well. Like
Really?
if you actually want to calm a cat down, they recommend to give that
Gabapentin.
Yeah, before you
and
take
and
them.
I used to have Atarax and Sedzine for skin and itchy.
Skin allergies. You can
Yeah,
always have a
allergy.
tablet of Evil. You can have
Huh.
Sedzine. You can have those basic things are fine. You can
Yeah,
have those.
and you must check with your vet how much
Quantity is very
quantity is
important,
required
yeah,
for your
yeah,
dog,
depending on
or
the
cat.
weight, yeah.
And when you medicate an animal, it's always based on the weight of the animal. Correct.
Yeah.
That is something
all
you have
the
to always
medicines,
keep
drugs,
in mind.
doses, everything is on
On the weight.
depending. Yeah, but you
Yeah.
have to confirm whatever you're giving, and never keep antibiotics in your first aid kit, because those are causing so much of like backlash. Like the bacteria are going crazy. Literally, I can say it in that way. where there is a thing called antibiotic resistance. Like
Okay.
it's become very common in humans now, but we still have a chance to, have it on a low scale in animals by
Yeah.
not using or abusing these antibiotics.
Okay. What do you think about Dr. Google versus
Oh,
you?
he's a long lost friend, a very close friend. But I mean, I don't know, with the technology and modern
Yes.
thing, like Chat GPT is the new big thing. Doctors are searching for diagnosis on Chat GPT.
Oh, really?
Yeah,
Oh.
it gives you all the answers in the world, so why not? So, yeah, Google was famous before, and people would Google things down, symptoms down. Humans do it too, because like I have done it too. I'm
Yeah, I mean, we all like to research,
Yeah,
right?
we
And on
like
one
to
hand, you have to
research,
research.
yes.
So, like, a previous person who was on the podcast said that it's fine to research, but the questions you're putting into the research is the problem. Like,
Correct.
he gave an example saying someone wrote, "My dog is pooping." Too many times,
Yeah,
right?
yeah.
Now, if it's a puppy, it's going
Yeah,
to poop 6 times.
correct,
But
correct.
Google is then saying, check for diarrhea, check for
Diarrhea.
this, check for that, and then so the questions you're putting
Yeah,
in,
yeah.
and he said they're relating this to because they don't poop 6 times a day,
Correct,
so they're
correct.
freaking out that their dog is pooping or
Yeah,
their cat
yeah,
is pooping 6
yeah.
times a day. So, what are your advice suggestions to pet parents? Like I'm one of those that will, if my vet has said, oh, this is the issue, I will get online and
correct.
research it for my own knowledge, right? Now, do you find that a lot of pet parents rather go on to Google before coming to a vet?
Yes, that is
And-
the issue. Like if you go to a vet and then maybe Google, that is also fine. Like just to find out if those are the correct things that your dog might have. Like the vet might have missed out also by chance some diagnosis. It happens. Like the vets are like, they're not like God, so they don't know everything. They will take some time to reach to the diagnosis, whatever they have studied, whatever their experiences are. They'll put everything into it to find a diagnosis for you.
Yeah.
But like, yeah, if you want to like have a background check, or you just want to see if what doctor, because we ourselves tell them like, this dog has canine distemper, please Google and find out, see what
Yeah.
the symptoms are.
But like, stop
see
treating.
how bad.
Don't
so
treat on Google.
Exactly, don't
I mean,
treat.
run your treatment that you have learned past a vet before
Correct.
you do it.
We
Because
have had clients with a printout of a Google, thing to show us, doctor, could it be this? And I'm
Yeah.
like, see, it could be, but showing whatever your dog is showing, the signs and symptoms that your dog is showing, might not fit this category
but
because
isn't it
of
good
these
in a way that
reasons.
they are researching at least?
Yeah. Correct.
clued
Yeah,
in,
we that's what we appreciate that, and we are saying even the vets Google sometimes. The
Yeah.
vets use Chat GPT, or the doctors use
So,
Chat.
Dr. Google is a friend and a nemesis, both.
Yes, kind
Huh?
of. If you use him for the right reasons,
Yeah, Dr. Google.
yeah, it can be
Okay.
very helpful. So yeah.
I mean, I recommend to people, like, before getting a puppy, find your vet and find your trainer. I actually tell people
Yeah.
to do that beforehand.
Might help,
And I
yes.
said, go to them and then, figure out which is the right breed for you
Exactly.
based on
Very
your
important.
lifestyle, based on whatever. Don't go once you've got it and then you're
Correct,
running
correct.
helter skelter, like
Yeah.
as a responsible pet parent. Get your trainer, behaviorist in place and get your vet in place.
Yeah,
And go meet a few and figure out which one you gel with
Very
for your
important. Like,
dog.
we don't differentiate between breeds and indies, and for all of them are like
Yeah.
dogs for us, and they are we have to take care of them. They are patients when they come to the clinic. But that's what, like, when we see people mistreating them, and like just like because rots are going to be difficult if you don't train them. They're
They
going
need
to
training.
like
They need training.
And then if you just
All dogs need
ignore
training,
you
dog.
ignore their help because you can't
Afford it.
or even you can't go next to your own dog. They're like, oh, I can't give it deworming because he will not take it, he will bite my hand, or he will not eat it, he knows the taste of that. So if
Yeah.
you're not comfortable doing that, you shouldn't buy a breed that is like
You can't manage.
difficult for you to manage.
Yeah, because I feel there are certain breeds for first time pet owners. Like, I would never tell a first time pet owner to get a husky or get, even get a bulldog or
Yeah,
get any of
yeah,
these breeds, because you have to be weathered to handle certain temperaments
Exactly.
and the health is another ball game altogether, of these breeds. Now, what are your thoughts on, this is one thing which I've seen a lot with my work, is dogs with hairy coats.
Yeah.
People tend to shave those coats because they feel the dogs are going to feel hot. So your huskies, your retrievers, your cocker spaniels.
Yeah.
In the summer.
Yeah.
And I have been taught that you should never shave a coat because the dogs can insulate their own
Correct.
bodies.
It's for their own protection.
And
They're
then the
built
skin
like
gets
that.
it, right?
Yeah,
Those are the skin issues
Correct,
from the
correct.
shaving.
But again, the thing is, certain breeds are meant for certain climates.
Yes.
Now, if you have a husky in Mumbai or a place like Goa, it's so humid
But you
and
should
so.
still shave.
You shouldn't shave. If you
Completely.
want, you shouldn't. If you want like a slight trim, maybe that will be
Yeah.
fine. But the inner fur coat should be there. They're double coats and all that. So if you trim the inner layer, also completely shave them, they're going to be directly exposed to the sun. That leads more. To get heat stroke and
Yeah.
things like that, or
And
even
skin
rashes,
disease, yeah.
photosensitivity. All this happens if you completely.
So you should be aware of this.
Yeah, another reason why they want to trim is because he got too many ticks.
That's the other one.
I'm
yes.
like, how does that help? If you trim, the tick will fall, but there'll be another tick on the
that'll get
body
on.
soon. So
Do
give
tick trick.
give tick and flea medicine.
That just gave me an idea. Doc, how
Hmm.
many groomers get in touch with you to ask you about these things?
We haven't had anyone asking
Don't you think
us
groomers
anything.
should be asking vets
They should
about
have a
skin
vet
issues?
on call at least for basic things. Even some groomers will have vets because cut or they're difficult to handle, so you give them a mild sedative to do that.
Do groomers
do it,
but they have to inform the parents?
Yes, exactly. They need to take their consent and all. But there a vet can be useful, or asking what kind of do we need to completely shave or trim, or
That's what I'm saying, with the health. Like,
Exactly.
groomers should be, so you've never had, in your entire 7 years, any groomer has gotten in touch with you for health conditions?
we had a groomer who came in to just volunteer and do we have this vet assistant course.
Yeah.
So she got a few hints and ideas of how we
One.
deal with animals. So, but it was just one. So,
So in 7 years,
yeah,
one groomer.
One groomer.
There's a difference between a vet and there's a groomer.
Please, yes, that is very important
Yeah.
to tell people that. I mean, we can see cut nails because nails
Yeah,
again
I should
can
take Watsi
cause,
for cuts because I didn't know I have nail cuts.
it
Yeah.
can turn and it
Yeah.
can cause issues. So we can cut nails, we can clean ears, but something like trimming and taking out mats and all that, we actually have.
That's grooming.
Yeah, that's grooming. So the animal needs it, but maybe not at a clinic. Can be done with a
Groomer.
That's much.
So you need to have a proper groomer and you have to have a proper vet. Basically,
yes,
as a responsible pet
Correct,
parent.
correct, yeah.
How important it is for vets to, just keep that owner going, right? And where is that line, when I know this is a really tough one, and I remember when Watson was sick, I told my husband and I told my vet, Nicole, to tell me that I don't think I will recognize it. I will keep fighting and I will keep trying to keep him going, but I need someone to tell me when it's time. I don't want my dog to suffer.
Correct.
How is that experience for you as a vet and with your clients?
It is
Navigating pet loss.
Yes, it is very, very tough, and it's tough for the pet parents, it's tough for us because we see such cases every day.
Yes.
Like it must be just one pet that you have which is in that stage, but we see it every day, and it's very difficult to deal with it, and we after we go home also it runs
You're
in our mind. We
processing it.
don't forget about it, and we can't
Yeah.
we can't disconnect. So I would when we talk, and these would be clients that you've been seeing for so many years, because the dog is 14 years old, 15 years old, he's old, or maybe not old but has a disease which is incurable or something like that, and you know that person very well. So that makes it more difficult. But I just ask them how do you think is his quality of life or her quality of
Yes.
life? That is very important for you to judge.
Yeah.
And most of the times, pet parents would keep their pets alive for themselves.
Exactly.
Because they don't want to let
Yeah.
go. That is a
Yeah.
difficult decision.
That's the tough one.
I agree. But then that's what, quality of life includes eating on his own, able to pee
Walk.
and poop, able to be a little mobile, kind of
Yeah.
walk a little, and able to respond.
Yes, when they stop responding.
Yeah, when you can see it in their eyes,
Yeah.
you can see they're barking, or they're licking your face or something like that.
Yeah,
So
that's
if
really
that's
tough.
not there, then you just think about how much he will suffer before naturally
And
going
what is,
away.
that it's such a broad definition of suffering.
Suffering,
And
yes,
it's so
true,
individual also,
Correct,
right?
correct, very
So it's
true,
that
very
quality
true.
of life. When
Quality
you
of
see
life,
that
yes.
life leaving your dog's eyes,
Yeah,
you
yeah,
have to kind of...
yeah.
Do vets prepare their patients parents for loss?
Yeah, when you get an idea of, you know, if it's a chronic kidney patient or something, we tell them that it's going to be very difficult for you. Okay, not only your time, your finances, your you know, stress levels, the dog stress levels, everything are going to just increase, and the dog might not make it through this. But if you want to try, it will be fluid therapy every day or dialysis, and you might require multiple sessions of dialysis, things like that. So people do get prepared, but when the dog or cat is young, it's very difficult to, like, you know,
Navigate
convince
that.
them or try to talk to them about it, because they won't be ready.
Yeah.
That's very difficult for us.
Yeah, because I remember, like, you know, Watson had a degenerative joint disorder,
Mm-hmm.
and his walking had become, so I bought that trolley which
Trolley,
you all
yes,
have.
yes,
You know,
yeah,
you
yeah,
have two
yeah,
of his trolleys
yeah.
with you, and our friend would like to be trolleyed
Mm-hmm,
down the road, and then he'd dire dire walk back.
Yeah.
Then I discovered acupuncture for dogs. So Dr. Akshay Shah would come and do acupuncture for Watson, and I
yeah.
would instantly see
Correct.
that the life picked up, the
Yeah.
walking, the stiffness got better.
Correct.
So I tried, and you know, Nicole really encouraged me on, you know, doing whatever.
True,
How
true.
open are vets to alternative healing?
We try to, like, kind of encourage. We have advised a few patients to undergo, like, physiotherapy is a big yes, that is required
Yeah.
as a supportive thing. Acupuncture, yes, if there are acupuncturists available, we
Yeah.
would recommend that for, again, for old dogs with arthritis or spine,
Yes.
you know, pain and that kind of thing.
What is the toughest situation as a vet you've dealt with?
Toughest situation would be something to do with euthanasias only, because it's really sad to, like, let a pet go, and even, like, the pet parent has tried everything, or even for the matter when we take decisions for, you know, the street free roaming dogs, like, you know, you just feel so sad that there is no place for the dog to go, and, you know, that there's
Yeah.
no hope, like, that the dog is going to get cured.
Yeah.
If it had got some palliative care, like we're talking about, you can delay the, you know, decision that you're going to make. But there, for them, we
You
have to take the decision. But for pet parents, again, convincing them, taking through that procedure, explaining things like concept of time, you know, like humans have a concept of time. We know that, okay, when I'm 40, I'll do this, when I'm 60, I'll do this. Dogs don't have that. They live
Yeah.
each day like a new day. They don't
Yeah.
have that. They're going
There's
to, like,
my senior dog, by the way, dog. This
Lucy.
is Lucy.
Lucy, hi baby. Lucy girl, come sit. Sit,
She's a
baby.
good
Go
girl.
sit, come and sit. Give me a kiss. Aleva.
Hi,
yeah,
Lulu,
it's very
yes,
difficult.
that you're the first vet she's done that with. When she sees or smells a vet, she's
Okay.
out. No, she's run out of the house
Okay, okay.
when the vet comes,
Yeah,
you know.
yeah.
So
Maybe I'm not smelling of dogs
Yeah,
and cats today. That's what.
Lucy is very like
yeah.
I sees a vet and out, gone.
But yeah. You know, you have different stages of dealing with grief,
Yeah.
especially. So sometimes it's so difficult that you have the animal has had some disease for so long, but
Yeah.
now when it comes to a clinic, even after treatment, it does not survive. It passes away. That grief is, I've seen, it's so, the tolerance is so less to deal with that grief. Like, people would literally call me and cuss and say that you're a killer. I mean, those things really, like, hurt, na? It's like we are humans too, so we can feel that. So, like, you're a killer, you are the worst vet, and you cannot.
Yeah, vets really get it, right?
Yeah, so it's so bad. I
But
mean,
sometimes, dog, there are vets, right? There are.
I mean,
in
yeah,
everything,
yeah.
right?
True.
There are.
Every
there-
profession has
yes,
those
every
people who
profession
won't
has
be
that.
professional. That's
you know,
true.
there is that fear, and
True.
also I think loss is something which is. I don't think you're thinking straight,
Correct.
right? You
So
wanna,
that's why, like, I was the one who I heard her out, so I didn't say a
Yes.
word, and she was, like, continuously
Going.
speaking
Yeah.
for around half an hour, and I was just like, I'm really sorry. I mean, just I'm apologizing, but the fact is that, you know, the animal had to go because it was suffering for so long, and it is something like a heart disease. If the animal had a heart disease, like how we get heart attacks, the animal would have got a heart attack. And then the blame game goes on and things like that. But I think after a period, they can deal with it and say that, okay, like, you know, it has happened.
I think
and
it's just human nature to just
It is
lash
human.
out
Yeah,
when you're
true,
in pain. I
true.
mean, certain people do
Yeah,
that.
yeah.
Certain people just go in. I mean, I remember literally the moment Nicole was with me on the phone. You know, like.
Okay.
Whew, she
I know,
was,
it's difficult,
you
yeah,
know, like
yeah.
she was on the phone with
Yeah,
me, and
yeah.
it was hard.
It's very difficult to lose a pet, I know.
Yeah.
I mean, out of the fear of that, actually, I don't have pets most of the times. I have foster puppies, but even when they get adopted, I cry because, like,
Yeah, it's
oh,
hard.
you know, it's like,
Now we're both gonna start crying.
I get, I mean, it's so difficult to hold back your tears when
Yeah,
you're
yeah.
actually even putting a dog to sleep, like you're doing the procedure, you're supposed to be a doctor and really brave, and then one tear is coming down. So it's really sad. Like,
Yeah,
it's,
like
it's
I mean,
very
I'm
difficult.
so grateful for my relationship with my vet. She was on the phone with me while he was going, you know, and she told me how to revive him, and I was like, oh, it was just a lot, like, you know, to process and all. And with that, we will now take a break. What a break we've had! We've had a thunderstorm. We've had Lucy getting scared and running all over the place. Stupi has gone for his training class. Khujli has come back from Hicks
yes.
and run off. One of my streeties that I feed was being treated at Hicks for a tumor by Dr. Anaita only. And yeah, he came back. His friend Rusty has received an anti-rabies vaccine thanks to Mission Rabies. So we've had a lot go on right now. And now we're back. It's been raining and we've now blessed with a little no rain time. So we'll keep going. So Doc, where were we? Pet loss. I think we'll move on to the next topic from there. What are the processes like your animal handlers at your clinic work with? You know, like what are their protocols?
So most of our vet assistants, as we call them, or animal handlers, they have been trained under seniors to kind of follow protocols in carrying the dog or restraining a dog or even medicating. So medication always has to be done under the supervision of a vet. They are not allowed to, you know, give medication on their own. So there's always a vet supervising them. But yeah, they just get trained while they are working. Some of them have undergone like a certain veterinary assistant course, which is also good to, you know, like just to get you started with those things. But yeah, they just learn at work, and they are trained from time to time. If there is any changes in the protocols or that we are following, they are always guided, and you know, they are under supervision all the time.
How do the animal handlers in welfares identify individual needs of dogs? Do they?
That concept was actually introduced by you and you know, like Julie from Mission Rabies, and like in the camp, you know, more or less kind of identifying the actual behavior of the
Those
dog.
cards,
Those
Julie.
cards were very helpful. We still use them at our.
You're using them at
yeah,
Hicks?
we use
Oh,
them.
wonderful.
From that, it is already changed to like, you know, very
anxious or scared.
anxious. Slowly change, you see, and then you see like a happy tail
Happy
wagging
tail.
kind of dog. So by the end of their stay, they do change their behavior if we work on them.
Do you think the canine trainers and behaviorists stepping into animal welfare will help change things?
A lot, yes. Unfortunately, for some dogs, if they are not
Socialized.
used to
Yeah.
humans, for them it's really beneficial if you have a behaviorist or a you know, trainer at the shelter or the rescue center
To help them.
just to help, and especially dogs who are going to stay for a long period. Like if it's a thing of 1 or 2 weeks, we can just give extra care and food and all that. But if a dog is going to stay for a month or longer than that, they need that kind of, you know,
Attention.
mental stimulation and enrichment and all that during
so
their
that's
stay.
very important.
Yeah.
What is the difference between a private vet, a government vet, a welfare vet?
Difference.
Salaries?
That's so true. Yes, salary. That will be the first. I think it will be private first.
Will be.
And government is also, they're well,
Well paid?
and
Okay.
it's a very stable kind of a job. So you get pension and also.
So there's a lot of perks that come with it.
Perks. I remember like.
Oh yeah,
when-
you've been a government vet.
So after I did my post graduation, I literally made 3 columns. Okay, that's what we have been taught in college. So we only have those 3 things in mind. So I had put private practice, I had put government, and I had put
Welfare.
Okay, sorry, not welfare. I had put this studying to go abroad.
Oh, yes, we have to talk about
so
that
those
also.
3 things I had put. I hadn't put shelter anywhere. So those 3 things.
Oh, shelter doesn't come in
And
the thought process.
No,
huh?
because we are not taught much about shelter practices, medicine in college. So none of the students know that there is this
Avenue
path
as well.
also that you can choose.
Yeah.
So I made columns, and I wrote, first thing, like you said, I wrote the salaries.
Yeah.
Then I wrote what are the pros, what are the cons, like whether you have to travel, all that thing. And then I felt the best thing for me that time was private practice to gain experience and things like that. So that's what I feel nowadays vets are kind of exploring this, you know, charity shelter aspect also. and when they come to places like WVS or they visit some nice shelters, they
Yeah.
kind of get inspired to do shelter
Charity work.
kind of charity work. It's not again charity, they
mean,
are
you all
they are
getting
getting
salaries, yeah.
but it might not match the
Private.
salaries of private or government vets.
So, do you think therapy is important to integrate into the veterinary space?
I feel it is important, but that's the main thing. You have to have that time for yourself to get therapy.
You have to make
Yeah,
that
you
time.
have to
doc.
make that time.
You know, because
yes.
I mean, what I've noticed, because I've been working with you all for a
Yeah,
while,
yeah.
is I mean, your job is not easy. You're dealing with animal emotions. You are dealing with your own emotions,
Yeah.
and you are dealing with the emotions of people bringing in these animals,
Exactly,
right?
yeah.
And then this is just your work. Then I'm sure you have your own personal emotions and
True,
personal
true,
life
true,
stuff
true.
that you are tackling
Yeah, yeah, yeah.
as well.
Yeah,
So, I mean, I genuinely feel that we really need to bring in mental health professionals into the animal welfare space to support you all.
Correct,
And
correct.
it's not just about the vets. I think your animal handlers need it too.
Yeah,
You
everyone,
know, the boys,
rescuers and
the
handlers
boys that
and-
are running around all day,
Yeah.
you know,
Yeah.
chasing dogs
Yeah.
to catch dogs,
yeah.
and you know, and just at it.
Yeah, therapy helps
Everyone.
everyone, and that's what, like, I even sometimes feel just me coddling a dog or like petting a dog takes half my stress away.
yeah.
That is for temporary, but
But you need something to keep you going, because
Yeah,
this job just
there are
it's-
few cases that even after going home I will think about
Of
it, and
course.
it's always
How can you
playing on
disconnect?
your
You're
mind.
human.
You can't.
Doc, if you had one dream wish for animal welfare in India, unlimited amount of funds, nothing holding you back, what would that be?
Like, because I am really close to this kind of shelter work and like welfare work and all that, I would really want to have some kind of a system where I can actually help reach out to all these shelters. I mean, there are a lot of people who just out of compassion and want to set up a shelter, but they don't know how. They don't know how to have like different wards for infectious disease. They don't know how the drainage should work, or disinfection, or like having basic protocols of what should be done for dogs. I mean, I would really reach out to whatever shelters I can and give them all the
So get the
things that
shelters
they-
right.
Shelters right, yeah. That can make a big difference for
Animal
the
welfare in
animal
India?
welfare, yeah.
That's so
Yeah.
nice.
Yeah.
If you had to give advice to pet parents, whether it's cat owners or dog owners, on 3 tips that with regards to their health that they can start working on from today, what would it be?
So first thing, we have to make sure that the pet parents can make sure that all the preventives are done. Like some things that you can prevent, better to get that done.
Which
so
is?
like deworming, deflea, deticking, vaccinations, all are up to date. Okay, so that kind of is one particular section.
Yeah.
If you do that, you can ensure that your pet will be healthy.
Yeah.
Then second would be again making sure that like if the dog is sick, to take the dog to a vet and not kind of just try home remedies for a long period, rather just get a consultation
Yeah.
done and get it checked. And the other health thing would obviously be proper diet and nutrition. So not feeding too many snacks, like the dogs
Yeah.
might just ask. Toxic foods, avoid fried foods and things. Like the dog will obviously have your snack, and
Yeah.
it might just upset the entire digestive system later. So better to avoid that. And yeah, generally just make it more comfortable for them at home.
Yeah.
Don't put them under any stress of excessive, like maybe even traveling sometimes it's stressful, or if you have like a very bad weather, then kind of make sure that
What we're doing now.
yes, now what we are doing, music is playing
Music.
and the dogs are like calm,
Yeah.
that kind of thing. So stress levels also for cats, like I told you, you
Yes.
have to maintain a very low stress level for cats. Yeah.
So you have to be kind of in sync with your animal's
Yes,
emotions,
yes,
right? And to pick
yes.
up stuff.
Yeah. I don't say my name like that, huh? That you meet Dr. Anahita
नहीं,
tomorrow.
वो
Monday को जाऊंगी तो एक line रहेगा उधर, नहीं चाहिए बाबा.
पकड़ो डॉक्टर.
That day somebody came, Dr. Anahita. I'm like, who told you I work here?
अब now तो your name's gone. अब तो सब लोग देख
हाँ,
लेंगे
ठीक है.
podcast
No, that's
में.
okay, but
No, I'm
don't
joking.
give appointments out now today.
Dr. Naita, thank you so much, for everything that you have shared with us. So thanks, Doc. Thanks for being here.
Thank you for inviting me. Thank you.
Please like, subscribe, and share this podcast with people you feel it would be beneficial to. If you have any questions, if you have any thoughts, please leave them in the comments. Thank you for watching this podcast, and give your animals at home a big hug and kiss from me. See you on the next one.